Hi everyone, my name is Dr. Riwa Sabbagh and I am the third year infertility fellow at Boston IVF. I am going to be graduating in 2 months and I am happy to be staying on at Boston IVF as a reproductive endocrinologist, and I'm hoping to meet some of you in the near future. So I want to start off by saying happy National Infertility Awareness Week. I hope some of you were able to tune in to some of our talks this week and enjoyed them. Today, I'm not going to talk about infertility per se, but a topic that's very much related, and I'm going to talk a little bit about fertility preservation. And then I'm happy to answer any questions that you guys may have on the topic. So for fertility preservations, there are different options for fertility preservations. We have egg freezing, sperm freezing, as well as embryo freezing. I'm going to focus my talk a little bit mainly on egg freezing, but we'll also touch a little bit upon embryo freezing. So egg freezing has really increased dramatically over the past few years. A lot more patients are going through egg freezing. And we recently found out that just in our center, it has increased about 93% just this past year. And there are different reasons that individuals may elect to proceed with egg freezing. It could be for totally elective reasons, but other indications for egg freezing could be for medical purposes. For example, if someone has a diagnosis of cancer and is going to go through cancer treatment, so they may elect to proceed with egg freezing prior to treatment. We also can use it for or prior to gender affirming treatment for our transgender patients. A common question we get asked is when to freeze eggs. There isn't a specific right answer on when to freeze eggs, but in general, I would say if you're somewhere in your early to mid 30s and are not planning to have children anytime soon, and it is important to you to have children that are genetically related to you, then that would be a good time to start thinking about egg freezing, or at least meet with a reproductive endocrinologist to start discussing the process. In terms of how many eggs to freeze, that's another common question we get asked. Again, no specific right or wrong answer, but usually we would say aim for a good number of eggs that will give you a high chance of having a baby. Now, what a high chance, different people have different perceptions of what's good and what's a high chance. And when you meet with a reproductive endocrinologist, they can share some numbers and some probabilities with you as to how, what chances you have depending on how old you are. And then you can decide what is an ideal number for you. In general, we know that as we get older, the quality and the quantity of our eggs start to decrease. So we may need more than one cycle to achieve that adequate number of eggs that you may want. And that number depends on your age, can depend on your egg reserve, but also on your family building goal and how many children you wish to have. In terms of cost, I know cost is always a big question that a lot of you may have. Where more and more insurance companies are now starting to cover egg freezing, but it's still not really in effect in commercial insurance companies. But for example, for cancer patients or transgender patients, we tend to try to get coverage. But the majority of patients, I would say, usually pay out of pocket for egg freezing. And a ballpark cost per cycle is somewhere around $10,000 to $15,000. And that, like I said, is per cycle. And it usually does include medications that you will take, the monitoring that you'll go through, as well as the procedure itself, the egg retrieval procedure. Now, what the general process of egg freezing looks like. So you'll meet with a reproductive endocrinologist and talk about the egg freezing process. They will order some testing to look at your egg reserve and so on. And then based on that, we'll formulate a treatment plan for you to go through the egg freezing process. And once you start, it's generally about 2 weeks. During that time, so it starts usually with the first day of your period, and you're taking injectable medications for about 10 to 12 days, daily injectable medications for 10 to 12 days. During that time, you're also coming in for monitoring roughly every couple of days. Sometimes can get more frequent as you get closer. And what we're looking for is basically your response to the medication. So are your hormone levels going up appropriately? Are your follicles growing up to a decent size? And so that's what we're looking for. And once you get to a point where we think you've reached a decent number of follicles with a good size, good hormone levels, you'll take a trigger shot. And then you'll come in for an egg retrieval around 36 hours later. And the egg retrieval process, most people tolerate it pretty well. It's about 15 to 20 minutes. You are asleep. You get IV sedation. So it is considered general anesthesia, but you don't need a breathing tube. You're breathing all on your own. And it's 15 to 20 minutes, and you go home the same day. Most people don't take time off of work during this whole process, during the 2-week process, just the day of the egg retrieval so that you can come in and do the procedure and you are getting IV sedation. But it's usually a very quick procedure with a quick recovery time. And once that process is over, we freeze those eggs. And the eggs are frozen indefinitely. They can be frozen for an indefinite time. And then when you are ready to use these eggs, we thaw them and then we fertilize them with sperm and then create embryos that we can use to transfer in a uterus. This is what the process looks like for egg freezing. Now, when it comes to embryo freezing, usually it's the same process all the way up into the egg retrieval day. And then instead of freezing eggs, we fertilize them with sperm that day, watch them grow until they create embryos, and then freeze those embryos. And so in the future, when you're ready to use that embryo, we just thaw it, and then we can transfer that embryo in a uterus. All right, I'm gonna try to look at some of the questions that are coming in and answer some of them. All right. One question is, how many eggs should the average 37-year-old freeze for one potential baby? Again, that's an excellent question. And so the number of eggs will depend on age. And so your question is specifically at 37. So at 37, what we usually will share with you is what probability depending on the number of eggs. So for example, you may hear these numbers, but we may quote that to have about a 70% chance of having a baby, you need somewhere around, I would say 12 to 15 eggs roughly, or 12 to 15 mature eggs roughly. And that's usually what we would quote for a 70% chance of having a baby. But, we have different numbers for a 50% chance or a 90% chance. So like I said, when I was talking, it depends on what you perceive as having a good probability of having a baby, and that would be the number I would aim for. If you are someone that wants a 70% chance of a baby, I would aim for that number. If 50% is good, I would aim for that number too. One question is, should we tell the employer that you're doing egg freezing because you'll need to take time off for appointments or not necessary? So from a medical standpoint, you generally are fine and don't really need to take time off of work for, because of the medications or the process in itself. For monitoring, because you come in for monitoring every 1 to 2 to up to, anywhere between 1 and 3 days, we usually do monitoring, at least in our center, fairly early. We start at 6:30 in the morning and it runs all throughout the morning. So most people are able to come in before work. But if, you work earlier or you have time constraints, then I definitely do encourage you tell your employer. And you never know, somebody around you may be going through the same process. And just by speaking up and telling them, you may have someone else that you can share this with. And then in terms of a day off, I would say the day of the egg retrieval is a day I would take off of work. Yes. Another question coming in is, what type of prep is needed 1 month prior to the egg retrieval? So in terms of supplements, foods, lifestyle, that's also an excellent question because you always want to make sure you're nice and ready before you go through a process like this. So in terms of lifestyle, there isn't much that we can do. We're born with all the eggs we're ever going to have, and you're genetically predisposed in that kind of way. And so there isn't much you can do to improve the process. I would say leading a healthy lifestyle in general is good. So decreasing smoking or stopping smoking in general, decreasing your alcohol intake, leading a healthy diet is helpful to go through just to have a healthy lifestyle in general. But I wouldn't say there isn't anything specific that you can do to make the process more successful. Do you have to pay per month to keep the eggs frozen? That's another good question. So usually in terms of storage fees, there are different plans for storage fees. I would say the most common plan that we see is to be paid on a yearly basis. That's usually, that's what we tend to see, yes, on a yearly basis. All right, answering a few more questions. So the next question I see is, sorry about that. Does retrieving eggs naturally affect the possibilities of getting pregnant naturally or in the future? That's an excellent question that we actually get asked pretty frequently. So yes, you're born with all the eggs you're ever going to have, and you ovulate usually 1 egg per month. But what happens is every month there is a cohort of eggs that is recruited, and one will ovulate and the rest kind of die off. They just don't make it to the dominant follicle that is the one that's going to ovulate. And so when you go through the egg retrieval or IVF process in general, what we do with the medications is that we kind of rescue these eggs from dying off and allowing them to grow and retrieve them. So those are eggs that we would have lost anyway that month. So we're not depleting your pool. We're not taking eggs that would have been used in the future. And so we're not reducing your ability to get pregnant naturally in the future. Another question is, should we cut back on alcohol and weed before starting the process? I would say in general for alcohol intake, I would, moderate alcohol, mild to moderate alcohol consumption. This is just for what I'm talking about is for egg freezing in general. If you're doing this for the process of a pregnancy, I would cut back on both completely. But if you're doing it for an egg retrieval process, moderate alcohol intake should be fine. All right, I'm going down. Another question that's coming in is, how likely is a live birth from an immature egg that matured on its own in the lab's petri dish after 1 to 2 hours? That's a good question. So in terms of success rates for I'm sorry, I'm losing some of this. Okay, in terms of success rates from a live birth, I would say talk to your reproductive endocrinologist about if they freeze immature or mature eggs. We tend to freeze the mature eggs, but we do have a process of sometimes freezing immature as well as mature eggs. It's being more and more frequent now because we don't know if in the future we have any possibilities of helping some of these eggs be mature or used. And sometimes we do tend to put some sperm around the immature eggs to see if they fertilize on their own as well. So we sometimes will freeze both. Do you recommend just one retrieval or depends on the quantity retrieved? That it does depend definitely on the quantity retrieved. So like I said, it depends on how many eggs you want to have to give you the highest chance of having a baby. I would say the majority of people do this once or twice, twice being a very frequent number that we do see, just to increase the number. And that again will depend on your egg reserve. If you are someone with a high egg reserve, you may not need to go through this process more than once. But if you have a lower egg reserve, then you may need to do the process more than once. A question coming in is, I heard this procedure is painful. Is it from the actual injections, the side effects of the hormone medications or the hormone injections? The procedure itself, the egg retrieval procedure, you are asleep, you're getting IV sedation, so the actual procedure itself shouldn't be painful. You may be uncomfortable a little bit during the process. I would say because it's about a 2-week process, the first week most people do fine and don't have many side effects from the medications. The second week, some people may feel a little bit more tired, bloated, and that's because your ovaries are getting larger and can cause some side effects from just bloating in general. So you may feel a little bit nauseous, a little bit tired. So those are things to think about. And then after the procedure itself, you may be a little crampy, have a little bit of mild bleeding, like a mild period, and cramping kind of like a period-like cramping for a few days after the procedure, and then up until your ovaries go back to their normal size, and then you should be feeling back to normal. Another question is, do you recommend that all endometriosis patients freeze eggs? Endometriosis is a tricky diagnosis because we know it is a lot of patients with infertility could have endometriosis and vice versa, but not everybody with endometriosis has infertility. And so, I wouldn't use that as the sole indication for egg freezing. However, if you are in that age category that we talked about, the early to mid 30s, and, you're wanting to conceive in the future using your own eggs, or you may be undergoing certain surgeries related to endometriosis, like surgery to the ovary if you have an endometrioma and so on, then I definitely would consider egg freezing, because these surgeries could impact your egg reserve, and so you may be less successful in the future if your egg reserve is impacted. But it's definitely a conversation to have with your reproductive endocrinologist to find the sweet spot as to when to proceed with egg freezing with endometriosis. But I definitely think it warrants at least a consultation to talk about this process. Another question is, do you freeze eggs for women over 40? That's another excellent question. So like I said, ideally would be under 40. The short answer is yes, we can freeze eggs in patients over the age of 40, but the success rates tend to be much, much lower. And so to give you a ballpark of an estimate, so somebody over the age of 40, in order to have about a 50% chance of having a baby, would need to freeze over 30 eggs. And that's because the quality of the egg decreases. And so in order to achieve 30 eggs above the age of 40, you may need multiple rounds and multiple cycles, and that's just for at most maybe a 40 to 50% chance of a baby. And so the success rates are definitely lower once we get over the age of 40, much, much lower. Another question is not related to egg freezing, but fresh embryo transfer, is it good or should we use frozen? That's a common question so we see a lot more frozen embryo transfers being done now, because when you go through an IVF cycle, you create embryos, and ideally you create more than one. So we have a lot of frozen embryos embryos that are frozen that we can use in the future. In terms of success rates, they're similar in terms of using a fresh or a frozen. So deciding on using fresh versus frozen will definitely depend on your response to the treatment. Is it safe to proceed with a fresh embryo transfer? At least in Massachusetts, a lot of the times, insurance companies will dictate whether we proceed with fresh or frozen. So it's definitely not a clear-cut answer as to we should proceed with one versus the other, but success rates are similar for both. Moving on. How do you get over the fear of self-injections? I am not going to lie, I have a fear of self-injections myself. I think it's very difficult. And a lot of patients will call before they start because they're worried about how to take the injection. It's definitely difficult, especially to inject yourself. I would say we have, helpful videos and helpful resources that can, walk you through the process and help with that. Some people find like having a family member inject them makes it a little bit more easy. Also, I hear a lot of my patients say that it was hard the first time, and then, the second, third, fourth day and so on, it's not as scary and not as painful. So I would say, some people, build up the courage and do it themselves the first time and then are fine. But I would say a lot of patients have somebody do it for them because it's not easy to inject yourself. Another question is, how soon after egg retrieval do you discover how many eggs were retrieved and the health of the eggs? So at our center, we usually let you know before you go home that day how many eggs we got. So we do know right away. So as soon as we retrieve the fluid from all the follicles, our embryologist takes a look and lets us know how many eggs you got. And so we let you know before you go home. And then the following day, you'll know how many of them were mature. And so those are, that's another number that you'll get the following day, and then they freeze them. In terms of the health of the egg, so the quality, that we only will know once we fertilize them and create embryos. And then we see how they function and what the quality is. So that's when we get that answer. How long is the recovery after egg retrieval, after stopping hormones and having ovaries go back to normal? Usually the recovery is a couple of days. I would say you may feel, a little crampy and bloated and achy, maybe 1 to 2 days after the retrieval. You've stopped the hormones about a day and a half or so before the egg retrieval. But I would say 2 days after the egg retrieval until you're feeling fine and well enough and basically back to normal. But in terms of your ovaries going back to their normal size, it could take several days up to a week for them to go back to their totally normal size. Another question is, how do you improve the quality of the egg at the time of the procedure? That's a very good question. And, quality is, we don't really have a measure for quality. The only measure that we use is age. And unfortunately, there isn't anything we can do to reverse that. And so leading a healthy lifestyle can definitely impact, because things like smoking and so on can definitely decrease your egg quantity and quality. But I would say there isn't anything specific other than leading a healthy lifestyle that we could do to really improve the quality of the egg other than age. Can you do exercise while doing egg freezing? That is another common question we get. And the short answer is yes, you can exercise. I would say low impact exercises is what we tend to recommend. So nothing like high impact, running a marathon, anything that, requires anything that's really high impact, because mainly it's the risk of ovarian torsion. So what that is when the ovary twists on its blood supply and causes pain. And it happens when the ovary gets larger and it can twist on itself. And so I would say the first week your ovaries are not that large. The second week they tend to get larger, and so we usually recommend low impact exercise. Walking is fine. If you have like a Peloton, a stationary bike, that's fine, things like that, but I wouldn't do anything high impact. Is having a regular period an indication of egg retrieval success or not? Having a regular period is definitely a good indicator. It just indicates that you're ovulating every month and that you don't have an ovulation issue. But having regular periods doesn't really give us doesn't give us an idea on what the quality and the quantity of the eggs are. And so, though it is a good indicator in general for a successful cycle and successful pregnancy, I wouldn't use that as a marker for an indication for success in the egg retrieval. I would use more your discussion with your reproductive endocrinologist on what your egg reserve looks like, and then they'll also base it on your age. Can a low AMH be improved? So unfortunately, the short answer is no. The AMH is the anti-Mullerian hormone, which is a measure of egg reserve, and the egg reserve is really impacted by age. And so there isn't much we can do to improve it. There are certain things that sometimes it could be a little bit lower. For example, if you're on a oral contraceptive or a birth control pill, it could be a little bit lower. And so when you stop it, it may increase slightly, but we're not really improving it by doing that. And so I would say that no, there isn't much we can do to improve the AMH, unfortunately. Another question coming in is, do more women use frozen eggs to get pregnant themselves later on? So that is a good question. And I kind of wanted to touch on that as well, is when is the right time to use these eggs that you've frozen? It is a fairly new therapy. And so now we're seeing more and more people come back to use these frozen eggs. So if you were to ask somebody maybe 5 or 6 years ago, they would tell you, I don't know how many people come back to use these frozen eggs. But now we're seeing more people come back to use these eggs. And so the discussion to have is, when is the right time to use them versus, using the current eggs that you have at the time that you come in. And so let's say you've frozen your eggs in your early to mid 30s and you're back in your late 30s and you're ready to conceive, and you've, now have a partner and have had trouble conceiving. I would say a general recommendation would be sometimes to use the current eggs that you have, especially if you're still in your, mid to late 30s, would be to use your current eggs and see if that works. Because if it does, great. Because the frozen eggs that we have, we kind of want to leave those as a last resort, because they're usually your best bet at having a baby because you froze them when you were younger. And so, most people, we would recommend using their current eggs and try with an IVF cycle. Either do that alone or in combination with thawing the eggs that you previously froze, and then fertilize those with sperm and create embryos to be able to use. The one time or the one scenario we would usually recommend going straight to using your frozen eggs is usually when you're older. I would say over the age of 40 to 41 or 42, because the chance of success with IVF using your current eggs at that time is very low. And so your highest chance of success would be to use the frozen eggs that you froze previously when you were younger. All right. What is considered a good number of eggs to get during a retrieval? A good number of eggs will depend on your age and will also depend a lot on your medical history. And so from an age standpoint, because, I would say usually you'd hear people say, somewhere between 10 and 15 eggs, that's excellent. But that'll depend on your age. If you're under 35, 10 or 15 eggs usually tend to have better quality and better chances. And I would say that's an excellent number. But once we get a little bit older, if we're, over the age of 40, 10 or 15 eggs have a much lower chance of leading to healthy embryos or healthy babies. And so ideally we would like to have more eggs. So again, that number is very variable and will depend on age. Another question coming in about supplements. So in terms of supplements, I would say any individual of reproductive age taking a prenatal vitamin is definitely very important. It has, a prenatal vitamin is very important because especially if you're planning a pregnancy, because it has the folic acid component in it, and usually it is helpful within the first 4 weeks of your pregnancy when a lot of people don't know they're pregnant already. And so that's why we take a prenatal vitamin. You had asked about calcium and vitamin D. I think especially vitamin D is an important supplement. So we tend to see a lot of vitamin D deficiency, especially here living in Boston or in Massachusetts. We're not exposed to a lot of sun. And so a lot of people end up being deficient in vitamin D. And so I would say a vitamin D supplement is definitely important. And you can also get your vitamin D levels checked with your OBGYN or with your reproductive endocrinologist as well. But those are the main supplements. I would usually just recommend a prenatal vitamin is the most important one. Does having a hormonal IUD affect egg retrieval? Good question. And no. So a lot of patients that come in for egg retrieval don't want to get pregnant. They just want to preserve their fertility. And so they have their IUDs in place. And we keep it in place during the whole process. So during the process of the monitoring, the labs, the egg retrieval process itself, it should not affect anything. So we definitely, you can definitely keep it in place. All right, I think our questions are slowing down. So thank you guys. Thank you guys so much for joining today. I'm going to answer maybe a couple more questions. Do people use surrogates? In terms of, you're referring to gestational carriers, and We have lots of patients that use gestational carriers, and that's for several different indications. And so it could be from pregnancy-related complications. It could be from, if you have contraindications to being pregnant, from unsuccessful implantation, and so on. So there are several reasons why a individual may elect to proceed, or a couple may elect to proceed with using a gestational carrier. And so it's definitely something that we do and that we can help you with at Boston IVF or anywhere else that you would like to go to. Is there any chance of twins? So again, not related to egg freezing, but is there any chance of twins at one time? That's a good question. So that'll depend on what kind of treatment you're going through. So if you're going through IVF, our general recommendation, and that's based on the American Society of Reproductive Medicine, is to transfer one embryo at a time, and that's what we call elective single embryo transfer. And that is to decrease the risk of twins because, twins and higher order pregnancies are usually more complicated pregnancies. And so we kind of want to avoid having a complicated pregnancy. And so we tend to transfer one embryo at a time. Now, there is always the chance of that embryo splitting, and that's not something that we have control over. And that's usually about a 1% chance of that happening. But then there are instances where we transfer more than one embryo, and that'll depend on your prior treatment cycles, your prior success rates or not, and then your age. And again, insurance also dictates a lot of this here in Massachusetts. And so though there is a chance of twins, our goal is to usually have you have a single embryo that's transferred leading to a healthy baby. And then I'm going to take this last question. And is it safe to take CoQ10 or any side effects? No side effects that I am aware of for CoQ10. And it is safe to take coenzyme Q10. Usually a lot of people ask, can it help the quality? It's a lot of mixed data on does it help or not. But I would say it's not a harmful therapy. It doesn't have any side effects. And I think it is definitely safe to take, and you can take it throughout the process. All right. Next question is PGT-A important to do? PGT-A is always a question that we get asked very often. PGT-A or preimplantation genetic testing, when we're testing the embryos for the number of chromosomes, so basically for aneuploidy, for the number of chromosomes, reasons to do it or not to do it, that'll be a discussion that you would want to have with your reproductive endocrinologist. And then reasons to do it will depend mainly on age. We have a lot of data to suggest that anybody over the age of 35 to 37, it could be beneficial to do preimplantation genetic testing for aneuploidy to kind of decrease their time to pregnancy and decrease their risk of miscarriage. And there is a substantial amount of evidence that shows that under the age of 35, it may not be beneficial because the probability of having a chromosomally abnormal embryo is low. And so you may elect to not proceed with PGT-A. And so that's usually where the recommendation lies is depending on your age. All right. All right, everybody. I believe I took the last question. I want to thank you all for joining. Again, happy National Infertility Awareness Week. I am glad I got to talk to some of you and meet some of you today. And I want to urge you all to reach out and consult with a reproductive endocrinologist if you're struggling with infertility, to talk about your struggle, see if there are any treatments for you, and also if you're looking to preserve your fertility and talk about egg freezing. All right. Bye.